Amy Madre from Madre Optometrist.
I'm Graham Hall from Toga Optical Greenacres.
My name is Robert Nettle. I'm a registered optometrist with the South African Optometric Association.
I'm Dr. Dean Barclay. I'm an ophthalmologist in private practice at the Eye and Laser Institute.
Spectrum Eyecare offers a holistic experience for the patient. Not only tests, but integrates trade products. Consumers are far more informed than before. They understand what's going on in the industry. There's Google, there's intelligence out there. When they sit in that consultation room, they want to know answers. Answers to pathology, answers to product, answers to why do they need that specific product. Spectrum equips the optometrist with all that information and more, either printable to the patient or can be emailed to the patient after the consultation, just giving the patient that reassurance of what has actually happened in the consultation room and giving them the understanding of the product prescribed.
When I used it, I just thought, no, this is for me. It was so user-friendly. It had all the tests I needed and more.
Spectrum is definitely more user-friendly.
It's so much easier testing with Spectrum.
It integrates both the patient information as well as the diagnostic test.
The major benefits that Spectrum Eyecare offers an optometrist is that he's able to enhance or encompass all the tests he can go and buy out on little bits and pieces of equipment are now all incorporated into one system.
I'm dealing a lot with children with learning problems, and I found with Spectrum they've got the slides for children, for grown-ups, for any person, for any interest, which focus their attention to a distance object.
In terms of the visual acuity test, there's different optotypes, so you can move from letters to numbers to images to pictures, so it gives you a variety, and also the fact that you can take your VA charts and your VA lines and you can actually randomize it so the patient doesn't memorize the lines.
I use the contrast sensitivity feature extensively, particularly with patients with macular degeneration as well as cataract formation. Often with good vision and good lighting, the patients can see quite well in the test room. But the minute you drop the contrast sensitivity, their vision goes down remarkably if they have a disease process.
Other specialized tests that Spectrum offers are cross-reference tests like the fan and block and the V-pointer, which previously one could not do on projectors and other systems.
With that system of Spectrum, anything what comes out new, you can just infiltrate it into the computer system.
I find that Spectrum definitely increases my turnover, the reason being that patients are impressed with the technology.
Yeah, I really enjoy the way my patients react to the Spectrum program.
The feedback from the patients with regard to Spectrum is normally one of that they haven't been tested as thoroughly as one's able to test them on Spectrum before.
When patients walk in and they see the visuals, they see the marketing visuals, they are excited, they want to ask you what's happening, what is anti-reflection coating?
We have increased our transition sales in the store since we've used Spectrum.
When you show them the difference in multifocal, for example, you show them the generic one and then the upgraded one and the upgraded one. When you really show them the top one, they all want the top, the best one.
It allows me to explain to my patients so easily. For example, if you're trying to explain to a patient the difference between the benefits of the reading glasses versus the progressive reader, and you put on both the pictures, you show the patient exactly how they're going to see with the reader, and you show them exactly how they're going to see with the progressive reader. They actually see the benefits immediately.
It saves me a lot of time and explanation to the patient.
It speeds up my testing tremendously.
You know they can see that if they can see the letters, they will definitely be able to give you a far more accurate refraction.
The patient is getting the best of eye care when you're using Spectrum.
What's unique about the Spectrum system is we've put masses of effort into making it able to run on any PC or laptop.
It's not just an eye test or an eye exam for them anymore, it's now a visual experience.
It's going to be fantastic for other ophthalmologists to hear about the product, and once they've tried it, I can't see them using anything else.
Definitely I would recommend Spectrum. It's just easier to use.
Actually, I've already recommended Spectrum Eyecare to my colleagues.
Well, I personally recommend that Spectrum Eyecare to any optometrist. And if they don't take it, they don't know what they're missing.
In the future, all optometrists will be using a digital system. One cannot fight technology. The question is, will they be using an inferior system or will they be using Spectrum?